Hi, I'm Judith McKernan, and I'm the owner of a New You Skin and Body Clinic in Woodstock. And Dr. Yalif is going to be injecting my lips and a few other places on my face today with a hyaluronic acid filler called Juvederm XC. The XC just means that there's lidocaine in it, which means as he gets started, that area will be numbing as he goes along. But I've also applied a numbing cream topically to the areas that we're going to be treating today, so I'm already anesthetized to a certain degree. It's really nice as you're aging to get a little fullness back in the lip because our lips actually thin and shorten. So when you create a little more volume in both directions, you get more support to the tissue. And your lips do not have to look crazy and wacky and overfilled. Just a very small amount done well can make a really nice difference on the face. And lengthening the lips will also help the little bit of the turn down that women complain about, that oral commissure. The other things that I want him to address today is a little bit of a pre-jowl sulcus. So it's in front of what we call our jowl, where a lot of women break down too in what we call the marionette lines. The filler can also be used in the nasolabial fold, which means from the nose to the lip. And I don't like to create a very solid look to my own face or to someone else's face, and I like to leave a little bit of a break. But we're going to reevaluate as we're going and decide if we want to put some just up by the nose. And then we're also going to add a little Voluma, which is a newer hyaluronic acid, to one side of my cheek. It's the side that I do lay on every night, and so it thins out faster. And that can create a little bit more symmetry to the face. It also helps create a little lift across the cheekbone because as we're aging, the cheek pad actually flattens and makes our face look fallen in the middle. I don't have a lot of filler in my upper face. I just have extra pounds that put a little fluff there. So adding some to the outside will create a little bit better angle and give an uplift to the eyes. So we're about to get started.
We're about to inject, as we just talked about, we're going to do lips, pre-jowl sulcus, a little bit of cheek as well. We're going to be using Juvederm XC plus 16, whatever. And the idea here is, as Judy was kind enough to explain, is to try and augment the lip, but not in an artificial way. Try and make it look as natural as possible. So what we're going to start with is actually just doing the border of the lip to get a little more plumpness there without making the lip itself technically bigger. That's where we'll start. Make sure that we're happy with it. We do it two ways. We go ahead and we topically make it cold by putting cold on there, and that helps numb it up. Two, there's some local anesthetic in here, and then as well as we continue through, we're going to hold pressure, make sure that we don't get swelling just from me repeatedly putting a needle in there. All right, we're going to get started.
Start right at the corner here, and we're not injecting right away. What we do is get into the lip and get to the area where we want to inject, and then gently thread in a little bit as we go, right at that border between the red portion of the lip. And what you see is an immediate fullness relative to the other side. And we give that a second to really let the lidocaine that's in the filler work. In addition, you see we're using that topical cold spoon to make sure that it keeps the swelling and the pain down. And we continue, again, right along that line, and injecting just at the line as we go. And again, we immediately see a fullness relative to the other side. We're not injecting large amounts. We're doing small bits, one at a time, and then what we do is after we do about 1/2, we're going to check with the patient, with Judy, to make sure she likes it. If she wants more, we can always put more, but we can't obviously put less. Sorry, dear. All right. Now, one of the things I like to do as well is a little philtrum, which is those two little columns that go up to the base of your nose. So I'm going to go ahead and do that. That is one of the more painful shots, but I like that. I like that look. Usually does pretty good, and I apologize in advance. It's just a little Little aliquot right there. All right. So what I think we have, just as a beginning, is we start to see that fullness that we want. Now, I know Judy, she probably wants me to put a little more volume there, especially down at the corner to try and fill that out. So just going to hold pressure for a second, get that. And then we'll go ahead and inject that extra volume down there. And then we'll stop and look relative to the other side. That wasn't too horrible, was it? All right, so then what I usually do is we'll take the mirror and take a peek. More?
That looks pretty.
You happy with it? All right, good.
It really did not hurt. There was a couple sticks that feel like a pinch, but it really does not hurt. Hold pressure on
I'm going to
that.
start on the other side to try and equalize what we've done on the right upper lip. We still haven't done the lower lip yet. We're still on the top. And what you see currently is my assistant holding pressure. That's for two reasons. One, obviously we don't like bleeding. And two, we want to minimize bruising and swelling. So by holding the pressure, she's helping me do that while I continue to the other side. All right. You ready, Judy? I apologize. And it's the same thing here. We're going along the border as we did on the other side, just to try and get it to start to fill out. And then we can always add more. Oop. Sorry. Right along that border. Big pinch. And when we come up to the apex here, we're coming right to that philtrum, which is those two little columns on either side. And we're putting a little extra right at the apex of that philtrum, those two little columns. And we do that to draw attention to what's called Cupid's bow, which is the upper lip looks kind of like a bow. And the apex of that bow is a very important marker. It's just something we like to define nicely for women so that draws attention to the mouth. All right? A little bit of that bloodening goodness. And actually at this point, let's see, I'm going to do that same pinch, and I apologize, Jim. All right. Actually add some volume to the upper lip itself. We've got a nice crisp border now that we've lined with the filler. And now we're going to actually add volume to the upper lip itself. We do this for a couple of reasons. When we look at the normal proportions for lips, we want to have roughly the upper lip being 1/3 and the lower lip being 2/3. That's changed a little bit in recent years with Angelina Jolie lips and things like that, where up to 50-50 is okay. So 50% upper lip, 50% lower lip. Much more of a discrepancy, meaning if you go above 50% for the size of the upper lip, it starts to look a little weird. So we're not going to want to do that, but what we definitely want to do is just augment the actual volume in the upper lip a little bit.
So let you see what it looks like without the body.
All right, and this will also, by increasing the volume, will increase the show of that red portion of that lip. So I apologize in advance, Judy. We start to see fullness right where we injected relative to the other side. I'm going to continue going down. Make sure we stay even. And then you can see I need to inject just a touch more right up there to be getting the whole lip kind of roughly where we want it fullness-wise. So now what we see is right away by injecting not even a tremendous amount of volume, but just some volume in there, we immediately get a fullness to the entire lip that we do not have on the other side. And of course, obviously, I'm going to hold some pressure, make sure it feels good and smooth as she moves her mouth, and then do the same on the other side. Okay, so we're going right into the body of the lip. Just providing some volume. A little bit lower. Now what we do in addition, which you haven't seen me do, is I'll actually put my fingers over the lip and in the product and just make sure it feels good and smooth. We don't want to leave it lumpy. We want it to feel nice and contoured and stay right where we put it. So just smooth it out a little bit. It does cause a little bit of bleeding, but again, the idea is to create a nice smooth contour on both sides that is symmetric. So now once you're nice and full on, we'll show a post in a minute. And we've also done a little bit in the pre-gel sulcus that Judy talked about. What you can notice here, right here on the arch on the left side, which is the side she sleeps on, is that it's a little bit flatter, just a little bit. To correct that and make it a little bit fuller like it is here on the right, we're going to be using the Voluma, which is a Juvederm product, more cross-linked and lasts a bit longer, to provide that volume right there. And we'll get to that in just a minute. But that's the defect we're going to go for right now. All right, so now we're going to go ahead and we're going to place on the arch where the end of the cheek is. We're just going to put it right into the bone there. And we're on the bone, and we're injecting small aliquots of the product to increase the projection. All right, and as you can start to see, we're not quite there yet, but we're already now evening up our volume. As we head back, we're going to need a little more volume anteriorly to try and augment this area. All right, Judy, back up. So, we have a fair correction now. Moving down. We have a good amount of symmetry. I'm going to continue to inject just a little bit lower to make sure that we get rid of the sulcus or the little bit of hollow there. But again, we've already projected now that area. And now we're just going to fill it in.